Okay, so when we're talking about pressure and massage, there's no one size fits all answer. How I like to measure it is if it's a pain scale 1 through 10, 10 being really uncomfortable, like you are going to the ER. You only want to get out of 5 to 6 in the pressure of what's comfortable to you. What happens is once you start the massage, we establish a pressure of your preference. And as I move through your body, sometimes in certain areas that sensitivity can spike up or go down. So it's very common for someone to ask, hey, could you use more pressure here? Or hey, this is a sore area, lighten up a little bit. Now, this idea of no pain, no gain is not very true. A lot of people come in and see me and think, oh my gosh, it has to hurt really hard, go really deep. I want to be jumping off the table for you to get everything it's worth, or whatever the idea is about it. However, when you're using a lot of pressure and the body is not able to take that much pressure and it's tightening up and it's kicking me, my hands or my elbows out of that muscle, we're not doing any good. And it leads into more bruising and soreness because we're not synced up. So the best way to get into a deep tissue massage is to start off lighter, establishing a pressure, and then gradually going in deeper so that your muscles stay relaxed and the adhesions that need to get ripped, the muscles that need to get stretched, or the knots that you want to get worked out can be done in the less resistant way. It's easier for the therapist, and B, it's better for your body and the recovery of it anyways. So the last thing we want to do is shock your body and just like beat it up, because what happens is that the next day your body's like, what the fuck it just happened? So if you like deep pressure and you can handle it, that's your preference, it's okay. You just have to communicate. Open communication is key. And if you don't like deep tissue, that's completely okay as well. So I just kind of wanted to shatter that myth. I reached out to the massage therapist community asking what kind of videos you guys not necessarily need to be educated on, but what, the therapist would prefer you guys knew, and that was probably the number one that came up. And so I think it's very important as well, and I get it answered all the time. So I hope everybody's having a great day. And I do want to share a little short story about it. So I had a client come in, oh, I can take deep pressure, just give it to me as hard as you can. I'm like, okay. So I'm massaging, and I hadn't seen the person for quite a while, and they came back to me for the second massage. And when they get on my table, I come up, because my room's upstairs. I'm like, all right, are you ready? Blah, blah, blah. I asked a little bit about the pressure last time. And they tell me like, okay, don't beat me up like you did before. Like, I don't want it, because they were so sore. So I think that sometimes like getting in there, the idea of what you think should be is different from what you actually need.